So, just a little bit of context on why I think it's important to talk about implementation. So, some of you may remember a commentary that came out of the Canadian Medical Association Journal, and in this commentary, the author said that Canada is essentially a country of perpetual pilot projects. And what they were arguing in this commentary is that the way that we fund research results in a lot of pilots that don't actually make their way into sustained programs that we could see outcomes at the patient or at the system level. And this kind of method of funding projects that are really kind of stopping at the pilot and not thinking about long-term impacts and sustainability is actually doing a disservice to our health system. So, about 5 years after that, the Lancet journal published a series of articles around research waste, and they described what's called a leaky pipeline of research. And in this series of articles, they were essentially saying that the way that we're doing research is not necessarily the most efficient way. So, we're asking questions that might not be important to our knowledge users, might not be important to our patients, and actually missing the mark on what some of those health system priorities are. We're not looking at what research has already been done and trying to add to it, resulting in a lot of duplicated work and research waste. And when we are doing research, we are not always reporting exactly what it is we're doing, and we're unable to kind of learn from each other's successes and failures. And so what's happening kind of in the way that we're funding research and the way that we're conducting research is resulting in this leaky pipeline of research waste that's not letting us realize kind of the return on investment in research in terms of patient and systems outcomes. So, knowledge translation was seen as a potential solution to this problem. And so, knowledge translation or KT, there's a lot of kind of different terms floating around when I talk about knowledge translation. I'm using the Canadian Institutes of Health Research definition, which talks about a dynamic and iterative process. And within knowledge translation, it includes both the knowledge synthesis, so thinking about the quality of the evidence, the dissemination of that evidence, and then what's kind of the feature of our talk today, the implementation of that knowledge. So essentially, it's about putting knowledge into action at all levels of the health system in order to improve health. And along the way, we want to be doing what's called integrated knowledge translation, which is essentially doing research with the people who use it. And so these people are called knowledge users, and they can range from patients, caregivers, all different types of clinicians, policymakers, administrative personnel, etc. And we know that when we actually work with knowledge users early on, it results in research that's more relevant, more applicable, has greater likelihood for implementation success, and then greater likelihood to have impact at that patient and the health system level. So these are examples of different knowledge translation strategies, implementation strategies, many of which I'm sure look familiar and you may have used in your own setting. And but these include things like audit and feedback, communities of practice, educational materials, and local opinion leaders. So again, it's not that these are necessarily, novel strategies that you may not have seen before. The key here is making sure that we're picking the strategies that match the barriers and that we're operationalizing these in a way that aligns with evidence and a way that aligns with user needs. And so I'll make a plug kind of in advance of your next session, which I think is focused on evaluation, is along the way, we really want to be evaluating iteratively to think about what happened and why. And we want to evaluate the quality of our strategy. So how well did we implement these strategies? And if we implemented them well, did we start to see signals in behavior changing? And if we started to see those signals, did that actually result in changes in practice? And if so, did those changes result in patient and system level outcomes?